Hi, Dr. Tehrany here with my patient. This gentleman is with the Customs and Border Protection.
Yes, sir.
He's an officer, and he was kind enough to let us do a little teaching. He was doing some dips and working out in his home country of Colombia, and he started to feel the shoulder, not only pain, but shift. And so when we did the right examination and we did MRI imaging, we noticed his shoulder's unstable. So a gentleman in his position, who's an officer, needs to have that shoulder as close to perfect as possible because of risks that are involved if he can't do that. So we're going to go ahead and we're going to reconstruct his shoulder and get him back to any comments or questions?
No, sir.
Okay. Okay, we'll see you soon.
Thank you.
Hi. So here we have the Customs and Border Patrol agent that I was talking about before. Poor guy's got a dislocated shoulder, and I think I need left. I'm going to clean up a little bit and show you the shoulder joints. So this is the biceps tendon, this tubular structure right here. This is the socket glenoid, this is the ball. And then here, this is labrum tissue, and it's torn off the glenoid. This is abnormal, it shouldn't be torn that way. There's also a small crack right there, and a tear right here, which I'll show you later. So what we're going to do is we're going to prepare the shoulder so that we can reconstruct this part, take care of the biceps, and repair the tears that are here as well. So now we wrap tape around the biceps tendon because we're doing a biceps tenodesis. This is a drill. So that device makes a hole in the bone, and then my assistant attaches the suture to an anchor that goes into the bone. And that holds this biceps down into place to reconstruct that. Yeah. Mallet action. Nice. Screw that bad boy in. You want to wrap it? You good? Okay, yeah. So now that's going to hold the biceps. That's good. So now that that biceps has been secured, we're now going to do what's called a biceps tenodesis, which is we now cut that biceps tendon so that it's now secured. Instead of being secured here, now it's secured over there. We're still going to fix this slap because he's a high-level guy. Okay. So now we're going to go to the part where the shoulder has the labrum torn and it's causing the shoulder to shift in and out. This is labrum. Torn off the bone here, torn off the glenoid socket. There's a little bit of damage here down here as well, so we're going to repair all of this. Okay. This is me passing an instrument through this torn labrum here, and then a switching stick to put in a cannula. Takes the tape, this metal device. It's kind of a loop that I use to then pass suture. So now I replace that metal with this stitch. Would you please just put that? Nice. My PA is going to grab that other stitch nicely. And then he's attaching those stitches to one of those anchors like one I showed you recently. And then I create the area where the anchor is going to go to pull this label back. So watch how that labrum, that tape, see how it's pulling that labrum in, making it nice and tight? That's the key. Make sure we can see it well. He buries that black line to make sure it's deep enough. And that anchor is deep in bone. So that red stuff coming out is stem cells and blood. And the stem cells are going to come into this tissue and heal it for it. That's how he heals. Great. And so that was on that side. Now we're going to do it on this side. So here's the final product. One anchor anterior, two anchors posterior. You have a nice buffer of labrum instead of it being torn like it was before. He should do really, really well.